So I'm Angela. I have been in the health system a very long time. I've had decades-long experience across the health system. Started out as a registered nurse in critical care and then sort of switched into digital health about 2 decades ago. So I've been doing work, sort of local health district, then state and then federal policy, large-scale digital health reform. And I'm currently now with Oracle Health for good. So my first time in the private sector, which has been a very big change.
Yeah, I can't imagine, but bringing lots of experience too, which is fantastic.
Yeah, and it's a clinical role, so it's, I think what I like about it is the fact that you get to sort of, I'm part of a broader clinical team, we get to work sort of right across, influencing kind of all of the different processes within Oracle Health. So not just sales, pre-sales, post-sales, working with clients, out in the health services, having a bit of an impact on sort of future thinking and also on this, having a bit of an impact on sort of the product development, I guess. So it's a really interesting role, lots of scope, and I think it's been a good decision. Early days.
Yep.
So
fantastic. Yeah. That's great. Yeah. So what brings you to the Digital Health Festival?
Well, Nathan.
Yeah, well, other than me.
I have 5-year-old, but I thought, yep, I'm there. Well, 2 things, I guess. One is that I'm here with Oracle Health.
Yep.
We have a booth, and so we're, I guess, using it as an opportunity to talk about all the great stuff Oracle Health is doing. And I'm also on a panel.
Okay.
So I'm on a panel speaking about all things clinical governance. I'm alongside 4 other amazing people, and we'll sort of bring sort of very different perspectives, I guess, and we're going to be talking a bit about, the importance of clinical governance and what it isn't, I guess, and why it's so hard. So that's what we're doing this afternoon.
Yeah, I'm sure it'll be a great conversation.
Yeah.
I guess from that, for those who won't be able to be there, like if there's a couple of takeaway messages that you'd like them to have for our listeners at home, what would that be?
I guess my key message around clinical governance is that it's not as hard as people think it is, that it isn't a sort of it's not bureaucracy, it's not red tape. Governance, I think, in general is a bit of a brand problem. And when people think about that, they think, that's going to be something that's sort of getting in our way.
Yeah.
It's a sort of something we don't really want to be thinking about. And that's not to say people don't want to think about it, but I think it needs to be embedded. So it needs to be sort of thought about as part of a kind of larger system, much like health. I mean, when we think about systems and we think about safety, we're thinking about sort of the kind of end-to-end, and clinical governance is really integral to that. And if it's sort of designed and built properly and embedded properly, then it should just be part of the sort of cycle of thinking, part of a culture, part of a story. So
yeah, not just something bolted on later or
Yeah, totally. I think, my observation, having, been working in different environments, is that it doesn't always, if it hasn't been thought about properly at the front, the clinical governance people will come in toward the end and slow everything down. And that's really not the intention. I think, it depends on how much exposure people have. I don't know how mature the organisation is, how big, how small. But in the end, sort of, if we want to design, build and implement safe systems, if we want to make sure that the care that patients and consumers are receiving is safe and of a high quality, then it's part and parcel. So
to be there.
But the only other thing I would say is that it actually doesn't have to be hard. There's lots of ways in which you can think about it, or lots of research out there to draw from, and don't overthink it.
Yeah.
Because there's a lot of people out there who can help.
And great. The one question we're asking all of the people who are here for the interview is, what's your big thinking idea? Something doesn't have to be to do with clinical governance, but a thought or an idea that's sort of come to you as part of this festival that you'd like to give to our listeners?
I would say, for me, it's about, I don't know if it's a big thinking idea, but it's really about connection. So events like this are really about bringing everyone together. I mean, there's such a diversity of people here. There are thousands of people here, all different stripes, I think. And, it's a great opportunity to collaborate. So obviously you see old friends, you make new ones, but, as Pete likes to say, collaboration starts with a conversation.